I am fully recovered from my traumatic experience. And what a privilege to be able to say that. Like when you get high quality evidence-based treatment for your high acuity needs, it works.
Carter Barnhart. I am, first of all, like my mama bear vibes with you today. Well, my mama bear vibes with you have always been really strong, but I just feel like I'm such a proud mama bear today having you here.
I could not be more excited to be here. I was in the elevator and I just couldn't stop smiling like ear to ear. I was walking around my office this morning and I was like, oh, I'm going on Melissa's podcast.
I want to take everyone on a journey because you and I have been on such a journey together. So first, to really introduce you, Carter was my first coaching client. So when I first started in this space, I started as a health coach. I worked at the Morrison Center. I was the first health coach he ever brought on. Shout out to Dr. Jeffrey Morrison. We love you. And Carter was the first person that I ever saw. And you changed me.
I changed you. You changed me. I will never forget you walking out. And I was early 20s, burning the candle at both ends, just exhausted and not taking care of myself at all. And I had met with different coaches before, different people. And I remember you walking into the room and I got this overwhelming feeling throughout my body. I was like, this is going to be different. And I knew that working with you was going to change my life from the moment I met you. It was the energy that entered the room even before you of just everything about you. I mean, you walked in with this huge smile. And at the time it was, I think our first session, we talked about food and what we were eating, and you would eat with me. And just those little moments that we had together right in the beginning as a young 20-year-old trying to find themselves. I mean, I get emotional thinking about that time and our time together.
I mean, it definitely brings me to tears, and I'm sure there's going to be some roller coaster of emotions on this one. But so I just really quickly want to just take one breath, and then we're gonna go in a little deeper to when we work together, because you are a completely different person. You are so, first of all, you are so in your joy. Like seeing you laugh and smile the way we I'm like, I never heard that laugh out of you when we worked together. I don't think I heard you laugh often.
Yeah.
And now to just see you in your body and you're just, first of all, you guys, this woman right here is such a boss. And the reason why I wanted to have Carter on was for so many reasons, right? So many of us, including myself, when I was in my 20s, I was lost, I was insecure, I was struggling with an eating disorder, I was living a life of shoulds. I had a lot of people in my life that I don't think really truly loved me and supported me, but when you're in that cycle, it feels literally impossible to get out. And you can't imagine the other side of things.
Yeah.
And now to have you sitting here as the CEO and the co-founder of Charlie Health, this is a personalized intensive healthcare that is changing the world. You are single-handedly changing the world of mental health. And without a doubt, you are one of the fastest growing, if not the fastest growing healthcare in the world, you guys. And this is a girl who, it makes me cry. You were so broken. And I felt like I had to piece you back together because you couldn't even see yourself. And now to just see what you've grown, what you've built. Charlie Health has gone from 0 employees to 1,000 employees, 1,000 team members. They have treated over 25,000 people, and that's not even including the families. Because as we know, when someone gets treatment, it is a domino effect for everyone in their life. And I have full body chills.
Me too.
I'm like, are you kidding me?
It's overwhelming. I think my journey obviously started way before you, right? And I think probably helpful to like kind of go back.
Yes, let's go way back
way
to
back.
childhood.
Great.
How it all stemmed
Totally.
and what got you to the place of.
Yeah. And I love how open you are about your childhood. I think just that vulnerability is what all of us need so badly. And that ability to just share and connect is what makes the difference. For me, I grew up privileged. I grew up in a 2-parent household. My parents did absolutely everything to protect me, always. My dad was my hero, and my mom was fiercely protective. And unfortunately, when I was 14 years old, I went to a concert and I was raped at that concert. And afterwards, I profoundly struggled with anxiety, depression, PTSD, and also the guilt of like, this happened to me and I have 2 parents that really protect me and take care of me. And now I'm struggling so much and just felt so alone, couldn't shake those feelings. And my parents did everything trying to help me, like took me to, therapist, psychiatrist, and nothing could help me to just sleep through the night. And finally, I remember my parents went to my pediatrician. And I mean, you can imagine, right? Like, this is, like, God forbid anything happened to your kids, right? You do everything. Like, you are the ultimate mama bear. My parents really, like, they were searching and searching. They went to the pediatrician and said, like, we've run out of options. Like, we don't know what to do here. And thank God the pediatrician said, this guy actually just walked in here yesterday. He just opened a brand new residential treatment center out in California for girls with sexual trauma. You should call him. And my parents called him, and the next day I was on a plane out to California. And they had just opened this small 6-bed house for girls with sexual trauma. And all of the girls I was the second girl ever. They literally had opened it the week prior. It's crazy. And I was the second girl, and then 4 other girls moved in. And they all came from similar backgrounds that I did. They had a similar story and were profoundly struggling too. And through that experience, I got to live with these girls. I got to form community. And really, it saved my life. I always, I think it's so important for us to know, like, I'm living proof that treatment works. Mental health treatment does work. And that was just the beginning of my healing journey, right? Like, you go to this intensive treatment. I was 17. That was just the beginning. I then went back to high school. Went to a new high school for my senior year. And everyone that I met, I would tell what I just shared with you, just didn't make me the most popular girl. Like, imagine being a new senior in a high school and you're like, I have sexual trauma. And I went to treatment for it. But I was so obsessed with this idea that I had hurt for so long and been in pain for so long, and that no one knew what the solution was, that I wanted to make sure everyone learned. Everyone learned that this, like, help could exist. Got into college, got into NYU. The wonderful thing about NYU is they let you work full time. And I just poured myself into work. I reached out to the founder of the treatment center, asked if I could come and work for him. He said, sure. And I spent the next 11 years working for him full time. And I worked 24/7 and saw my maladaptive coping as I was growing up was just throwing myself into work and losing my identity. And I remember meeting you when I was 20, and I was working, 100 hours plus in school, was running a residential campus, and just burning at both ends. Like, not knowing what self-love looked like, not knowing how to take care of myself. I felt like I'd been through this incredible treatment experience. And so it was my job to make sure that every single person knew it existed. And I would travel around the country and tell my story and do all of these things. But then I would forget to take care of myself. And it was that moment of sitting with you and you being like, Carter, like, you can't take care of everyone if you're not taking care of yourself. And there was something about how you said it in that setting that just really shook me. And I was like, oh my gosh, you're right. Like, I have to slow down and I have to figure out how to take care of myself. And it's such a, when I look at my life story, like, there's, the moments that stand out. And it was another one of those, like, feelings. I think for you, you talk about, like, stopping drinking, right? Yeah. You had this wonderful life, wonderful job. I was, running a residential treatment center. I was young. I had a job that everyone would want. And yet still I wasn't able to take care of myself. And I had to learn how to take care of myself, to fill up my cup first, and then be able to help everyone else. It's that whole emergency, put your emergency jacket on first before helping other people. And yeah, I mean, it was really what I needed. Fast forward, we sold the treatment center twice, which was just incredible for me as a young person to be able to be in the room with people who were making big decisions. I became the youngest C-suite executive at a Carlyle portfolio company and ended up leaving and starting Charlie Health. And the reason that we started it was, again, I was obsessed with this idea of everyone getting access to care, but residential treatment is inaccessible. It costs $90,000 for 45 days of residential treatment. I mean, that is crazy.
That's a lot of money.
There's wait lists, and your insurance may or may not pay for it. I mean, it's crazy.
And how many people do they, what is the capacity?
So when I left the residential treatment center, it was called Newport Academy, phenomenal gold standard in high acuity care. We had 300 beds. But the day that I left, we had more people on the wait list than we had in treatment.
Right.
So 300 beds, but think about all of the number of people that are needing that care. In the first year of Charlie Health alone, we helped more patients than I had ever helped in my time at Newport, because of the virtual model, because it's accessible, and because it's in network with insurance. And we take Medicaid. We're the great equalizer of figuring out how you can take every single person who's profoundly struggling and bring them together and find that connection and that healing that I think, in some ways, I think about your platform and what you do, and all of it is mental health, mental wellness, right? And in Hungarian, health means wholeness. So it's mental wholeness, right? Like, how do we all help create mental wholeness? And you do such profound work with the low acuity population. That's why it's the technical term.
Yeah.
Like the low acuity, And
that's why it's the price point that it is, because you want it to be accessible and attainable.
Yeah.
I always, when I started, I thought about that younger version of myself who was like, I needed to get out and get out of my house and honestly, literally move my body. So the first thing that I bought was a gym membership, but it was like $1,500 for the year. But I remember I paid cash. I saved it up because I was like, but not everyone can do that,
No.
And
I think not everyone also knows the connection. I think what you've done such a great job with is educating people of that mind-body connection and just movement allows you to come back into your body. And if, 1 in 3 girls have sexual trauma, right? The reality that we're facing is that whoever's listening today, there's 1 in 3 people who have had sexual trauma if they're women. And the number one way to deal with trauma is to get back into your body and get connected.
Right.
And that's through movement. That's through things like that. And it's moving with your heart, allowing it to move through you.
Literally.
So you can process it.
I feel like I have to share this story because, you have to bring it back. Carter was the first client that I had taken on. So when I would take a client on, it was it was you literally became my child. Obviously, I had strong boundaries in place, or maybe not, because it was the firfirst.
I remember
I definitely did some things where I would go to her apartment and you were uncomfortable dancing and moving.
That's the huge. I had this profound. I just started dating my now husband. And I remember Melissa, I was like, I'm going to this wedding with him for the first time, and I'm terrified to dance. She was like, what do you mean you're terrified to dance? She was like, we do Pilates together, and you're good there. What do you mean? I was like, Melissa, I can't dance. And I will never forget, you sent me this video of yourself dancing. And it was literally just you moving your hips.
I was like, all you need to do is just get it, let it move through you, rock and sway.
And you were in your bathroom and sending it to me. And it was those moments, though, of that deep connection. Everyone needs, you say mama, I say big sister, right? It's the same moment. I needed that someone to be in it with me, to have that deep connection, to be able to share the vulnerabilities, the moments where you're so scared. And you were, just exceptional at that. I do remember, though, you asking me, you're like, so you work in healthcare. What are these, what are the boundaries supposed to be? You're like, I'm just learning.
Well, we did some in-person sessions. And honestly, those like those sessions and our time together taught me how to work with people virtually. It taught me what people need to hear. I mean, when the first thing, Carter, when I started working with you, you're like, I need a diet plan. She was like, so I was just like, oh my God, we need to like scale it back. No, you were like, no, I need you to tell me everything to eat, when to eat it, how much to eat it, what time to. And I was just like, how do you wake up in the morning? And I just remember we had to literally peel it all back.
Deconstruct my life.
Deconstruct. I was going to say dissect. It's deconstruct.
Yeah.
And it's just to take like a deep dive, like really going through the lens of your life. People don't do that.
Yeah.
And that was what we built on for years, right? Like I did write things for you to eat, but it was so much more than a food program. It was learning how to meditate, moving consistently. You started to become consistent, but it took a long time.
It absolutely took a long time.
Years.
Yeah, years. I mean, I think the meditate, I had such a fear of sitting with myself. Like I was in recovery, right? I'd been through these things. I was on the other side, or so I thought and felt. And I remember the first time that you made me sit and meditate, I just couldn't do it. And I was like, Melissa, you don't understand. Like my brain's not wired that way. And
everyone says this, by the way. So listen to her right now. Listen to this girl who built this company, by the way, those 1,000 employees in 3 years.
And
to mention.
Thank you. And I remember you saying like the wonderful thing is you can rewire your brain. And again, it was how you presented things. It wasn't like it was the first time I'd ever heard these concepts, right? I'd heard of meditation. I'd done Pilates. I had, had a smoothie in the morning or had lemon water in the morning, but it was that combo stacking of like here's also the why and a relatable way. It was all built through connection. I mean, that was what made it work, was that I felt connected to you. And I think you can do that virtually. You can do that through getting to, I think most people feel like they know you. And they feel like they know you because you're vulnerable online and you build those opportunities for connection. We deliver virtual treatment at Charlie Health, and you're the low acuity, we're the high acuity. High acuity means we work with the people who are the most profoundly struggling. And so they're with us in treatment for 11 hours a week, all virtually. But they're with us for a lot of time of the week, right? And all we focus on is connection. Connection, connection, connection. And I think that is really, it's the antithesis to loneliness, right? If we think about how we can connect with people. And I think a lot about this idea of how, 200,000, we've existed on this planet for 200,000 years. And our species was wired to connect. We were set up in these hunter-gatherer communities that were all built around connection, collaboration. Parents were with their kids all day long, and then they're in their community with their kids, with the parents. It was like co-parenting. No one was individualistic. No one was competitive up until 15,000 years ago, which if you compare 15,000 years to 200,000 years, that's 5 minutes out of 60 minutes. So for the past 5 minutes, we've been existing in this world that is disconnected, that is selfish. You layer on COVID, you layer on social media, all of these things. And people wonder, why are suicide rates flying through the roof? Why are people struggling more? And it's like, we live in this new abnormal world. So maybe these are just normal reactions to this new abnormality that we're all stuck in. And how do we rewind and how do we figure out in this new abnormal world that we've been living in for 5 minutes, how do we connect and how do we find those moments where we can both be vulnerable with each other, learn about each other, and stop being selfish, stop being individualistic. Oh, gosh.
And also stop being so influenced by every single thing.
Yeah.
And those like boundaries. I feel like I can't imagine what you have to say about social media, but it's like a lot of the time people are so triggered by it, but then don't do honest inventory of who they're following. Or continuing to like peek at their stop following them if they trigger you.
Yeah. I think it also, too, is about just the amount of time that you spend on social media compared to real life connections, right? Like if we are, what I love is that you story tell in your social media presence. It then also gives people content. I mean, the amount of time I'm with my friends and we're like talking about like, did you see that blah, 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 this? Did you do this new flow? Did you do this? How cute is Eleanor? Benjamin. But it gives you, you're so raw and authentic. It's not just comparing your outsides. You take everyone along for the journey of the moments that are scary for you, the moments where you feel overwhelmed with fear, those dark moments, so that people know you're human. That's different than just looking at an influencer, which is not what you are. You are a whole person.
I mean, we all are, but I think some people can present in a way that can make you feel less than.
Yeah.
That can make you feel like you have to buy the latest of every edition of every design, or you're just not important enough or cool enough.
Yeah.
And it can be it's exhausting.
Yeah. Yeah. I certainly, I try with myself to just make sure it's the social media detox, right? Making sure you're following the right people, cleanse your followers.
Cleanse your followers.
Only follow people who make you feel good.
Yes.
And this whole idea of like hate following, I've never understood that. Like, why?
God.
Just
I can't. I mean,
you know way
as
more
you
about
grow, they grow. And I mean, I actually have so much compassion for them.
Yeah.
I don't hate them. I don't read it.
Yeah.
I mean, I will say my best friend is a savage and she'll be like, they're saying this. And I'm like, it's okay.
Yeah.
Like, it doesn't bother me an ounce.
Yeah.
If I was in my 20s, when I was in a very vulnerable state of not feeling confident in my own skin, I don't know that I would have been able to continue doing what I'm doing.
Yeah.
I think the timing for when things evolved for me too, I was in a place where I could handle it.
Yeah.
And to stand up against the online bullying, because that's also been a massive factor in the increase of suicide rates.
Yeah. Yeah.
Because of being brutalized online by people who unfortunately are unhappy in their own lives. And I feel for people like that.
Yeah. Like
anyone who's going to take the time to write a nasty message to me, and it's usually women that are mothers, that are, it's always the bio where you're like, huh? Like what? Like, how? You 4 kids, lover of all things. And I'm like getting this nasty message. Right. But I really feel for people who are taking time and energy out of what they're building to tear someone else down.
I think, people, as 2 female CEOs, people always ask me about, what's it like being a female CEO? Why don't you think more women are CEOs? And unfortunately, I think that like we're our worst enemies. It is women who are holding each other back. That's the problem.
That's the problem.
Like, look at how supportive your husband has been of what you've done, right? I run Charlie Health with my husband. I'm the CEO. Like, he is pushing me up and elevating me. And men are willing to do that. And I think there are many, many reasons why being a female CEO is hard. But I think that, we are our own worst, like our gender is so brutal to each other.
Brutal.
And it comes from that place of,
it's lack. They have what I don't have, but I want what they have.
Yeah.
And
yet women need each other.
Right. And we can all thrive and evolve in the same ecosystem of elevating and lifting and motivating, inspiring each other.
I read this study that was done out in Massachusetts where they followed 2,000 women who were struggling in their marriage. And the women who had a community versus the women who didn't. And the women who didn't share with their friends they were struggling in their marriage were 4 times as likely to die from physical health-related issues. And it's like, we need each other. We need each other. We need to be able to rely on each other. 80% of autoimmune issues are women. Why is that? Because we've all been taught to suppress our emotions. My number one thing I'm working on is my manageable anger, healthy anger, like bringing out. I'm allowed to be mad. And yet we've all been told, like, be quiet, stay in the corner. And I think especially as a CEO, you have to think about, what the behaviors that you're role modeling And it's a tremendous responsibility. And then inviting other women in so that we can all learn from each other is part of that healing process.
It really is. And also just owning and recognizing, like, when you're wrong. I think for me, one of the greatest things being a CEO and just the founder of Melissa Wood Health has taught me is to just own when I'm wrong and I make a mistake, or I
Every day.
sw-
Have
all
you
the
gone
time.
through a period of not making mistakes?
Learning to apologize to people and own that
Oh,
like, to me, that is just the highest level of self-awareness.
yeah.
That
Yeah.
I don't know about you. I'm like, can we just keep, like, what can we do to just grow
Yeah.
self-awareness within humans? And I mean, truly, that's what I
Yeah.
think meditation and movement does.
Yeah. I do our new employee onboarding every Monday. And I always say in it, I'm like, I'm a first-time CEO. I'm a first-time founder. I have no clue what I'm doing. I'm going to make a million mistakes. And I invite you along this journey with me where you're going to see just how human I am.
Mm.
And I think that that's too, I feel this pressure. I don't know if you feel this way, but I feel this pressure sometimes that I have to be perfect, that I have to be on when I walk into the office, that I need to show up for our employees, for their families, for everyone. And I forget sometimes that being human is actually what got me here. And that's my edge.
Yeah.
Like that you're a good person, that's huge.
Yeah.
And that's what your
No.
employees want to see, right? Like they want to see your humanness.
100%. And yes, I feel the pressure.
Yeah.
It's so funny because I got acupuncture yesterday and I feel this, like, I'm still, it takes a minute for the weight to release, but she was like, you carry so much. Like, we all are, right? I do think when you're running a business, it's a weight that you just, like, you didn't even know that you could hold, but it gets really heavy. And for me, it's just now getting to the place of, like, recognizing when I'm in a place that maybe I should work from home that day.
Yeah. I love that.
That is a remote working day. You're welcome, team.
I think about a lot too, like, the struggle of being an empath and being a leader. Because I lay in bed at night and I worry about, my employees' kids, their families. If we're going to have to part ways with someone, what does that look like for their life, right? And I see how the men in my life and even my husband is able to be more objective. And my empathy is certainly my strength, and I think yours as well. But it also makes it hard. And that's what is so heavy. And so figuring out how to balance that. And that's where, like, for me, getting in touch with my anger so that it's not just living inside of me. I think moving it out of me was the first big piece, which you really helped me with, was like, how does it move through me?
Yes.
And then how do you also own it, right? How do you own in those moments where you're feeling really frustrated and you own that manageable, healthy anger, manageable, healthy feelings so that you're not trying to be this, like, statue.
It makes me just so, I'm like beaming listening to you because I'm just like, the level of growth and transformation right in front of me is just, it gets me so excited for everyone.
Yeah.
Because the realm of possibilities when you really work on yourself and you don't stop. The work, there's no, like, finish.
Yeah.
There's no finish line. There's no final destination. Like, it's truly the journey of just evolving and elevating that it's intoxicating. Like, I don't drink because I'm truly getting high off my own supply of just the way I live my life.
Well, look at how different your life is from when we first started working together 10 years ago.
Completely.
Like, you were still drinking at that point.
Yeah.
You were still
I don't even think I, like, had built my first.
No,
of course.
You didn't even have any of this.
I didn't have any of this. I was like, take me back. No, none of it.
No.
But
you didn't have Eleanor?
I didn't have, no, I didn't. I want to really dive in for anyone struggling and to really understand, just because Charlie Health offers so much. And there are so many different
things.
There's so many different things, and people struggle from, addiction, eating disorders, like, sexual abuse. There's so many things. I'd love for you to just really go there and like just explain the bones of
Yeah.
Charlie Health, the why and how
Yeah.
it can help anyone listening.
So I spent, like I said, 11 years running residential treatment facilities, really creating the gold standard of what residential treatment looked like, what good evidence-based care looked like. And what I saw was this lack of accessibility for 95% of the population. So prior to Charlie Health, 95% of the population, when they were profoundly struggling, would go to the ER, would express suicidal ideation, would express what they were struggling with. And unfortunately, most of them would just get discharged back home. And
With
if you
what?
get with no plan, nothing. So the majority of people go from a 24/7 hospitalization to once a week therapy. I compare that to physical health as if you were in a car accident. If you were in a car accident, you would be brought to the ER. You would then go into some sort of inpatient. You would then go into a rehab. You would then go into physical therapy. It would be a scale, right? A continuum of care. Unfortunately, in the behavioral health space, prior to Charlie Health, there was 24/7 care. And then there was, for 95% of the population, they only had access to once a week outpatient care. So they would go from being hospitalized with like the surgery, right, to then once a week physical therapy. None of that in between. And they had a 31 times, and I'm shocked, honestly, it's not even higher, a 31 times chance of being readmitted. 31 times more likely to be readmitted after that 24/7 care going to once a week care than what we can do today. Today, what we see is we've created a continuum of care so that everyone can go from that 24/7 through that whole continuum. And we offer 11 hours of therapy per week to start. So they can be discharged from that hospital bed and then go home and heal at home.
Virtually. So
Virtually.
explain to me.
Yeah.
I just left the hospital and I'm like, I need help.
You just left the hospital and you know that you don't want to be readmitted. And so you'll either an adolescent or a young adult. We treat patients ages 11 to 35 years old. We have another postpartum track too, which I'll talk about also,
Okay.
because I know you like talking about that stuff.
Yeah.
But our core program is for 11 to 35-year-olds. And they're discharged from the hospital. And then they are enrolled virtually in our program. We do an initial assessment, and then we create a customized treatment plan. And the magic of Charlie Health is that we use this multivariate treatment mapping. Fancy words that just mean we find your community. We help you pair up with 5 other people virtually who are struggling with the same thing. So if you were admitted into Charlie Health, I would put you into group with other moms, maybe who have blue eyes, maybe who have brown hair, who came from similar backgrounds as you, had similar struggles growing up, and would put you into a virtual group with those people who you would spend 9 hours a week with virtually so that you could find your community. You could find that connection. And that is really where the healing happens. We do skills-based approaches. So we teach you different skills while you're in that group therapy session, whatever the evidence-based intervention is, whether you're suicidal, whether you're anxious, whether you're depressed, whether you're struggling with trauma and you need CBT, DBT, whichever alphabet soup of therapy
Can you
you
explain
need.
those two?
Absolutely.
Because I don't think people know.
Absolutely. So I think really so in our multivariate treatment mapping, what we're looking at is first the condition that you're coming in with. So what is your condition? Anxiety, depression, PTSD. What are you struggling with? Then we're looking at your age, because we want someone who's the same age as you in your groups. And then the modality that you would benefit from. And the modality that you would benefit from typically depends on your diagnosis. So I know you've shared that you've been in CBT therapy, right?
Yes.
Which helps you with your anxiety.
Yes.
And so it's skills-based work.
I have I don't even feel like I have anxiety anymore.
Is that amazing?
It's amazing. Of course, I have anxious moments.
Of course.
But I don't wake up feeling anxious.
Yes.
There's a lot of other reasons too, but
that's also one. I mean, how long ago was that you started seeing, what's it, Lindsay?
Lindsay.
Yes.
Yeah.
I remember you.
I love Lindsay, Dr. Lindsay Tolchin. She's amazing.
I remember when you first started seeing her.
Truly, no, but it's in combination with nasal breathing, mouth taping, deeper meditations, like also adjusting my meditation practice. Like today I did like listening to you about anger.
Right.
Whenever I start to feel an extra layer of fire, I'm super fiery.
Me too.
Yes. I have to move it.
It's manageable anger.
It's manageable anger. So I did, I don't know if you've ever done this one, the 29-minute clear and align Kundalini meditation with Erica.
Yes.
The two of us. And I have a breakdown and I break through.
Yes.
Fully did not want that to happen live, but it did. And I've just embraced it. But that one, it helps, like the breath of fire, like that for 3 minutes. First of all, your arms get so sculpted. Like it's kind of crazy how sculpted your arms look after, but that's not why I do it. I do it to release.
So breath of fire, I remember learning that and being like, wow, I've been holding on to this.
Oh,
Again, it's all about that manageable anger. Like, how do you not suppress the emotion? How do you go to it? And so, yes, it's whole wellness, right? How do we actually achieve that mental health, that mental wholeness? And so for us, we pair people into evidence-based treatment because, again, they're struggling more profoundly.
Right.
So they need the 9 hours a week of whatever the evidence-based treatment is for their individual diagnosis. So if you are anxious, CBT, which is cognitive behavioral therapy, might be best for you. Or someone who's struggling with suicidal ideation might benefit from dialectical behavioral therapy.
What is that?
That's
like?
DBT.
Right.
Also skills-based, teaches you skills such as riding the wave, really helping you to understand the emotions as they're coming up and then processing them. We also do mentalization-based therapy. We do motivational interviewing. We do EMDR. We do different interventions depending on what your specific condition is. And we named Charlie Health, actually named it after my co-founder's friend who unfortunately lost his life to an accidental overdose. And he would be here today if Charlie Health had existed. But we named it after him because we wanted to always remember the individual. Every single person that is profoundly struggling needs a different type of treatment. There is no one size fits all. That's obvious. Yet in mental health care, unfortunately, that has just been the norm that everyone gets one size. And who does it affect the most? It affects our marginalized populations. It affects our low-income communities. And what we've been able to prove with Charlie Health is that by taking Medicaid and commercial insurance, we've become this great equalizer. And so we take clients that are from low-income families, that are from affluent families. We put them into groups together, and they get well at the exact same rate. We've published a bunch of outcome studies with the University of Pennsylvania and with Yale on how the Medicaid population versus the commercial population does in our care so that we can really flip this narrative on its head, that these people can get well at the same rate if they just get the same high quality care. So by giving people what they actually need for their condition, for their age, and then also putting them together with people with similar lived experiences, I mean, it's beautiful. We launched in Montana, and we had kids living on Indian reservations that had never met anyone else who, the kids living in Bozeman, that's like their big city in Montana.
Yeah.
And they would meet people and they would hear those Me Too moments. It's what you create for the low acuity, we're just creating for the high acuity. And the best part about Charlie Health is that it works. We've had this vision since the beginning that we can build a world without suicide. Because of the space that I'm in, unfortunately, I've been to more funerals than I have weddings. And every single funeral I sit in the audience of, I look around, I'm like, this was preventable. Suicide is 100% preventable. We do not need to lose people to suicide. And for the first time ever, we've created a solution that works, that's scalable, and can really appropriately treat those that are most profoundly struggling. So that not a single other person, and my hope is that Eleanor and Benjamin, as they grow up, that they never know anyone who dies by suicide. And for the first time, that's possible. I mean, that's it's wild to think about.
I think about the funerals I've been to or just people online that I've known for years. And I'm just like, I can't believe it. And I'm like, how?
Right.
And it's obviously like when you're not in a place of struggle, it feels like, how could that? But when you're struggling, you understand it.
Of course.
You understand those moments of not being able to live with these feelings anymore. But I feel that so deeply in my soul.
Yeah.
I believe that we can have a world without, like, it doesn't have to
Yeah.
be this way.
Yeah. Obviously I'm sure you feel this way, being a CEO is a tremendous responsibility.
Tremendous.
And I wake up and I'm like, I have the keys in some way to like the kingdom. Like I have this solution that I know that if I get into every single person's hands, we don't have to go to more funerals for people who have preventable deaths. And it's a privilege, it's a responsibility. And my hope is just that we can continue to mindfully scale to ensure that every single person has access. And Eleanor and Benjamin's classmates, as they mature, suicide becomes something we don't even have to talk about.
I hope with everything inside of me.
Yeah.
It's incredible to see. Even just, it's happened so fast because you launched Charlie Health in 2020.
Yeah.
The most needed time in the world.
Yeah. Yeah. So we launched 3.5 years ago. And it has been just the success we've experienced has been beyond my wildest dreams. We had this vision pre-COVID to create this. I was running virtual alumni support groups from the residential treatment center I was at. I saw how high attendance rates were. I saw how engaged people were. You know this, running a virtual platform, people can own their experience anywhere, anytime.
Yeah, literally.
And so being able to create that I knew was so important. I did not know, though, that it would take off like it did. Like I knew we could help people who maybe didn't have access to in-person treatment. And so that was fine. That was enough. But seeing how our outcomes are better than the in-person clinics and why people choose us for where they send their people in their life that are struggling the most. I get chills every day. Like we hear all of these stories of people who come through our program and it forever changes their life. And it's through that we're able to grow. And like you said, we have 1,000 full-time employees, another 2,000 clinicians that work for us. And they are the clinicians who work for us are the most remarkable human beings you've ever met. My third co-founder, Dr. Caroline, I worked with her previously, and she has done a phenomenal job just building this clinical workforce of people who are compassionate, who care deeply. And we go back to our values in everything that we do. And it's really worked. It's awesome. It's amazing. I don't have words for how lucky I feel to be in this seat that I'm in today.
I feel it. And you just embody it. I'm telling you, the joy is beaming off your face.
Yeah.
It's so incredible. And I think, I already said, it's the thing that excites me the most on top of just the incredible life-changing work you're doing is to give anyone out there who doesn't feel like it's possible to turn their life around and create something that they're so proud of. It gets me so amped up for the hope that I hope it has people see within themselves.
That's my, obviously what I talk about every day is heavy, but I'm guys, I'm living proof that it works. This works. If you do the work, it works. You don't have to. I am fully recovered from my traumatic experience. And what a privilege to be able to say that. When you get high quality, evidence-based treatment for your high acuity needs, it works. The same way, if you show up every day for yourself, you move your body every day, you have some sort of morning routine, it works.
It does.
and it's you watch people, and I'm sure people look at you and they're like, how could I ever get there? And it's it just is you habit stacking little things every day, putting it on top. You also have the magic touch, but you have the little bit of magic sparkle that I don't think we can all get. But,
well, I think you can enhance your magic sparkle.
Yeah.
We all have a sparkle.
Yes. We just might not have the Melissa sparkle.
Well, it's something we all uniquely have, but people don't know how to access it.
Right.
I'm no longer afraid.
Yeah.
I don't think I always had it in the sense where you were but now I'm
You're not afraid of anything?
I'm afraid of, illness and death. That scares me for people I love.
Yeah.
But I don't feel afraid of things that literally made me like paralyzed to move forward for so long. And it's truly like I share this because I was terrified to speak on stage to
I know, I was gonna say, were you
hundreds or
scared before
thousands
your
of
first keynote?
people. I was nervous.
Yeah. Nervous is different than fear.
It was different than fear. I mean, I've been wanting to do these things.
You're always meant for the big stage.
I've been wanting to do it for years, but even though I knew that I wanted to do it and that I would do it, I was terrified of it.
Right.
And I mean, I'll be honest with you, what led me to this place is having someone in Noah's life. He lost someone to suicide. Even someone online that I have loved for years, losing their life to cancer. Like, I think we all walk around as if it's just like, I'll do it another time. And that starts to accumulate and that starts to build. And, the 3 months or the 6 months that you said you were going to do it turns into 6 years and you haven't done anything. That is not the life that I want to live. I don't want to be on my deathbed one day ever looking at, I should have done that thing. I don't. I just want to go for all the things. Anything that I feel even an ounce bit curious about, I am moving towards that motherfucker with so much grace. And I'm still feeling nervous.
Grace always. Moving towards it with grace always?
I move towards it with a level of grace instead of feeling like I want to run from the hills.
Totally.
Like a lion's chasing me. Like that was like my energy. And now I'm like, I'm going to give myself grace for the nerves, for still feeling the embodiment of fear, failure.
Like I mean, ask everyone, I'm like, when was the last time you failed? We all have
I've failed.
Yeah, when was the last time you failed?
Oh my God. I mean, I had a lot of failures in 2023.
Yeah.
A ton.
Yeah.
Listen, all the time.
Right.
Not hitting certain numbers every month. But to me, now, I don't look at that. I'm not letting those numbers dictate my level of success because I'm fucking happy with what I do and what I give and the movement that we're making in the world. I'm not going to let a number just because it's different than it was last year dictate. So I have a different perspective on failures.
I think when you get to that place where you're not scared of failing, that's when you get true freedom.
I'm not scared of failing. That's where I'm at,
We should all fail every day.
100%.
And it's the apologizing, right? You said there's strength in the apology. I mean, I think some of my best relationships come out of the moments where I mess up, where I fail, where we miss numbers. I have to call someone and say, hey, this is a disappointment. But it gives you that opportunity to be vulnerable, to connect, to hear me too, because generally other people have failed too. And if we're not all doing that every day, then like, what's the point?
I couldn't agree.
To push ourselves to fail.
I couldn't agree more. And to just own it. Like even to just, I think blend that into relationships in your life. Like I have a friend, I love her. I don't think I was there for her for a few things. And I hadn't said it to her. So I FaceTimed her and I like sent her a nice gift because I wanted to make her feel loved. And I like missed her milestone birthday. And I just felt like I should have made her feel more important for that. She's been there for me for everything. And I called her and I said, I'm really sorry. I have not been the best of friend to you. I could have shown up differently. And like, I own that. I want you to know that doesn't at all mean that I don't love you, because I love you and I value you so much, but like I could have been better. Like, do you know, it changes everything.
And how's your relationship now?
Incredible. I mean, she's great. It's not like she was holding anything. She wasn't
holding you in her grudge, but
she
you
wasn't,
feel
but
closer too.
Yeah. And I think it's really humbling and it just creates an openness. It opens your heart. Right? Like, I think the way to just being more compassionate and a softer, graceful. Like when I say with grace,
Yeah.
it really is just an opening of the heart.
Yeah. It's mixing of that like feminine and masculine energy too, right? I think
Yes.
that I find, during the day, I feel like sometimes I have to be powerful. I have to be strong. I have to be those things. I have to remember how important that feminine energy is too. Like
Oh,
that's
yeah.
the gracefulness, the delicateness that we approach the world. I'm constantly thinking about how do we balance those two
You have a
things?
beautiful blend, my dear. You do.
But I cannot
You didn't
sometimes.
always.
Totally. When I met you, I was in my masculine energy completely.
Super. I mean, I'm telling you, I sat down and she's like, I need a diet plan before I
Right.
leave. And I was like, oh God.
No, and I was,
We're
I
not
mean, I would be like, you're 2 minutes late.
Yeah, no. Oh yeah. She would.
And like I'm spicy too. I'm fiery, Aries, and I definitely have to find that balance because I need that in my friendships. And I think too, my friends, what I struggle with sometimes is that sometimes people just need me to hold space for them. And I'm really good at problem solving. Like I love solving a problem. And my best friend will say to me when she calls me, she'll be like, I just need you to listen. I don't need a solution right now. Like just listen. And it's such a good reminder for me of like, okay, I don't need to problem solve. I don't need to do this right now. Like I can just listen and hold space for you and not tell you what to do. And then when you're ready, you'll call me back and you'll ask me what to do. And then I'll solve it for you perfectly. But I have to remember in those moments, that's not what people are looking for. And I think especially with your kids, I mean, that's like the biggest thing in teaching resilience to kids is not solving their problems.
You guys, this is one of the biggest challenge. I think it's definitely something I'm very self-aware of. Having the podcast has made me realize that I don't have to talk even, I'm like, no, let your guests speak and you don't have to speak every second they pause for a breath. Like it's just, why do I know that? Because I've listened to my own and I'm like, shut the fuck up.
Totally. I mean, I'm so uncomfortable in silence and I've had to really learn how to sit in the silence. I don't feel like I've mastered it. I think it's so funny how you start your thing with Dylan giving you like, Dylan says I talk too much. So I'm going to try to listen.
She says just a little less.
Just a little less. But I think that that's, again, like you're showing your humanity and your vulnerability. But with your kids, it's like, I mean, I don't have children and I know I talk because I've spent the past 13 years working with family systems. And I look at the kids that struggle and it's never, ever because of a lack of love. Like if love was the answer, I wouldn't have a job. The people who come to us are so profoundly loved. And yet we see these two ends of the spectrum where we have parents who are taking care of everything for their kids, not letting their kids fail. And then their kids have no resilience because there's people like you and me who want to jump in and make sure that I would want to make sure Eleanor and Benjamin never had a bad day. And you have to let them have those moments.
You do.
And also, I mean, I think the other big piece is the disconnection too from you obviously work while you're here and then being off of your phone and being present with your kids and those things that we all, I think, are trying to figure out how to do in this overstimulated world.
It's a constant, the practice, it's just, I'm constantly like, I feel like I'm almost in training. Like it's a daily practice.
Yeah.
What helped me a lot with the kids, I actually had a friend say to me like, oh, if someone starts to bother or bully my kid in the park, I do nothing. And I was like, what? And he was like, no, that's not he needs to figure that out. Yeah. So I was like, oh God, okay, I really need to practice that because I'm the first mom. Hey, I'm like, to other kids, I can't help.
It is how I would be too.
Yeah. Like, I'm like, don't hit. But now it's very hard, but I try not to get involved.
And how much better do they feel, right? Then they get to conflict resolution on their own.
It's so important.
Without you jumping in, without you saving. And it's the same thing that our friends need. It's the same thing that people just need that space. And yet, as our type A selves, we want to jump in and solve. And generally it feels easy to do.
Right. It does.
But it robs them. You're robbing them of the opportunity. And I think that that's such an important thing to remember.
Mm-hmm. It is. Can you share your age? Is that okay?
Yeah, of course. I'm 31.
31 years old.
I actually turned 32 on Sunday.
Happy birthday.
Thank you. I said fiery Aries.
I have so many Aries in my life.
Of course you do, because you're fire.
I love
and you
fiery.
like other fire.
I know I do. I love fire.
Me too. I'm like only friends with fire signs.
I have a ton of fire sign friends. I'm so proud of you.
Thank you.
No, I have this deep love for you, and just watching you grow. You've grown into such a remarkable woman. You've always been remarkable, but watching you just really move through all your stuff.
Yeah.
And just the fact that you never gave up.
Yeah.
And even now it's like you just keep going, and you're changing the world. Like, this is so needed. And that's why I kept running into you too, which I felt like the universe.
Yes.
I was like, Carter, I need to have, I'm blown away by what you've built. And I think too, just being an entrepreneur and knowing what it means to have 20 employees, to have 1,000, I'm just like,
yeah.
I'm so proud of you.
Thank you. I feel the same way. I look through our text chain. I'm like texting you like, I'm so proud of you. This is so incredible. Just watching you. And I think it's that inspiration, right? I'm so lucky that I have strong female role models, people like you, who I can be inspired by, who make mistakes, who share their mistakes. And hopefully we just don't ever make the same mistake twice.
There you go.
That's key.
That's
if
key.
I make
You have
the
to
same
learn
mistake
from it.
Twice, then that's like problematic.
We have to autocorrect,
but
guys.
Yes. Yeah.
Good point.
I have to learn. But yeah, I mean, it's like I said, I think for me, it's I feel tremendously privileged. I get to be with people on the worst day of their life, and I get to take them to a place of healing. And there's something so special about creating those Me Too moments. And I feel really blessed. And by the way, my employees have a lot of feedback for what I could do better. Feel free to.
No, that's great.
Lots of feedback. So
yeah.
I am still that work in progress. And I hope that I continue to grow. Like with the second I stop growing, then I start failing. And it has to be every single day that we're just that tiny bit better than we were the day before. Otherwise, that's not good. Not good.
No. Oh, I'm just so happy. I love you, and I just can't wait to see where you take this.
I adore you.
Beyond. I just I see it. You're 31. 31.
Thank you for giving me a space to share.
I mean, I'm having you back because I want an update, and I just want to hear about all the changes.
Okay. I'll come back whenever. This is fun.
Isn't it?
Yeah, it's so fun.
It's like we get to hang out.
Yeah, we get to hang out. Exactly.